So apologies, guys, for the network glitch. We are back on air. So yeah, we're still talking about how you're able to, manage your finances. I think you stopped at the point where you said your first semester results were out and you had failed
Yeah.
and all of that. So yeah,
Yeah. Yeah. So like I had failed those first semester courses, and I took solace in the fact that okay, I also passed Lab 1 in that period. So it didn't pain me so much. But I
yeah,
knew what
okay,
the problem was because I didn't understand the system at the time. I was trying to still understand how things were going, and I was also struggling with the jobs and all. So I I reached out to my elder brother, who at the time told me to quit work for a while and focus on getting off my second semester results out, and
yeah,
also uh, yeah, taking off my second semester and also passing those receipts. So within that period of about 3 to 4 months, he he took care of my rent, and I um I had to handle my feeding and other things. You get.
yeah.
Yeah. So once my second semester finished, now after second semester, what is left for you is dissertation, and your physical presence is not needed in dissertation except you are doing something in a lab in the uni. So I
Okay,
selected a topic that would, even if I was in Nigeria, I could stay on my laptop and do that topic.
and do it.
You
Okay,
get. Yeah. So I left Swansea for London, and I picked up a job as a nursing assistant or healthcare assistant. It was
okay,
a band two role. Here, when they give you job, they classify you as in bands. I don't know if band one exists, but I think the lowest I've seen is the band two role. So I was working as a healthcare assistant at Royal Free Hospital, working with the nurses, as assisting them, checking vital signs, cleaning up patients, dressing their beds, just those kind of jobs. And one thing I did was I didn't let anybody know I was a medical doctor, you know,
wow,
because
okay,
there was no need for that. I would just do my job, go back home, ask questions. Okay, teach me how to check this. What does this mean? You know, and that money I got there was able to now start paying my rent in London and feeding me.
okay,
There was no room for any saving. It
wow.
was just, there was no room for any savings. Like, go out there, work, pay your rent, eat, go back there and work. So if I didn't work, I would probably be out on the streets. You get.
Yeah. We are
But
live on the show today. Hello,
yeah,
everybody. Okay.
yeah. But
Wow.
but, but I took up that role because somehow I knew that in London I was going to get something better. So it was easier for me to get something better while in the city than staying in Swansea and hope I was 5 hours away and hoping that someday I'll get something better. At the initial stages it was quite challenging because I would leave. It was like I was doing the Nigerian, so I'll leave Swansea by night bus, come to London, walk, enter night bus, and go back to Swansea.
Mm-hmm.
You know, it became very stressful, so
Wow.
stressful that one of my friends, Emmanuel, reached out to me and said, I think you should come and stay in my house for this initial period. That way, it will help you save some cost, help you also get involved and know how to arrange yourself. You know, so I did that job. While I was doing that job as well, I was also doing some locum covers as a healthcare assistant. So a lot of times I traveled out in different parts of London. Some of my friends felt I was enjoying because I was trying. They didn't know that I was actually going to different places to go and work. But one thing I learned from those jobs, they teach you humility. You know, they teach you humility, and you can't disrespect people. It's like they're giving you a position of trust. And some of the comments I got from doing that job, I still remember them. I was even talking to my mom about this. I remember one patient told me, "Oh, you're so respectful. Have you considered going into nursing after this job, and I told her that, well, the future would decide whether I would do that. But she was saying that because she felt like I was doing the job with so much compassion that she felt like
Yeah.
I deserved more, not knowing that I was even a doctor. You get. So I did that job for a while, and along the line, one of my friends called me and told me that in the UK that there was a role called medical support. It was for medical doctors who did not have GMC registration, and that
Okay.
if I was interested, it could link me up. What it means that you'll be working in the clinical area with consultants, with other doctors. You do everything that they do, but you are not going to prescribe. But they are going to pay you as good as they pay doctors.
Interesting. Wow. Okay.
Yeah. So he gave me that idea, and I'm like, fine, just send me the link. They sent me the link, and I interviewed for the role. And something miraculous happened at that interview. I had a black guy and a white woman in the board. So they asked me, walk me through your CV, tell me what you're doing, tell me this, and that. I finished saying, they asked me about some clinical scenarios. I talked about that. They asked me just general questions and said they've gone through my CV, and they said, okay, if we want you to start, when do you see yourself starting? And I said, I'm ready to start immediately. I currently work just down here, and I need to give them 1 week notice. So they were like, okay, we'll get back to you. And the black guy said to me, floret. And I said, floret. Now, floret is a slang that we use back in King's College.
Okay.
You know? So it happened that he went through my CV and saw that I was a King's College boy. And he was at the head of the employment panel. And he said floret, I said floret, and they closed the interview. At that point, I knew that no matter what, I was going to be considered for that role. Someone I had never met before. He went to King's College like 7, 8 years before I did. And 2 days later, I got a mail that they had taken me, that I should show up for induction, training, and blah, 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 and
Yeah.
all of that stuff. I showed up, and that's, for me, that was my break, my major break financially. I rented a bigger apartment, or a bigger room, let me put it that way, closer to the hospital, and I left where I was. I just gave them a notice. They said, okay, you have to do 2 more shifts. It was on the day I was going, and I'm not informed by the other nurses that I'm actually a doctor. I've gotten another role, and I have to leave and all of that.
Yeah.
They're like, there was this woman from Portugal, a black woman. From the first day she saw me there, she's in her 60s or 50s or whatever. She just liked me. I was like, black people, we need to support ourselves. Anything you don't know, please don't do. Don't get into trouble. If they ask you to do this and you don't know, come and call me. I'm going to do it. I see you like a son to me. I see you're hardworking. So when I eventually told her, she was like, wow. That she just knew that there was something about me, you know. So that's how I left that and moved on to being working as medical support. And
Okay.
it became, that was, for once in a very long time, I felt like a medical doctor, because you would go to the ward, you're going to see patients, you're going to document for, just like the regular house officer stuff that we do back in Nigeria.
Yeah.
Document, they will write the prescriptions, and they will engage you in clinical stuff. They will do clinical teaching. And I was paid more than the FY1s and FY2s.
Wow.
You get. So it was good money for me at that time. So I did the job. He gave me access to consultants. He gave me access to the hospital. He gave me access to doctors. He gave me access to materials for PLAB 2, because PLAB 2 is largely clinical,
Yeah.
you know. So, and I started doing the role as well. And by then I had passed my receipts. I had passed my second semester as well. I had dissertation left to do, you know. And I concluded that role. And somehow, within that role, I now became like I was now involved in training new people. So when they get new people in, I was involved in training the new people
Training
and
them.
getting them on board. I was also able to provide links to some of my friends, and they got jobs in the same hospital via the same means. So
Okay.
we now got there, and we also formed like a very small,
Community.
community of friends and people who, from there I got my PLAB 2 study partner, and we wrote our exam too and passed. And that was how that one went. But while I was in that job, I would say I made good impression to the best of my knowledge anyway. And when I got my GMC registration, I resigned from the role, and they called me to come and take up like a doctor role.
Yeah.
Yeah, like 3-4 days after I resigned from that role, and that was how I also changed from being a caregiver to being a kitchen porter to being a healthcare assistant and nursing assistant to being jobless to being medical support worker now to being a
A,
doctor in
pro-
the
a
UK,
proper doctor.
and concluding my MSc. So that was the journey for me. But in all of this thing, I would say that I had good support from my friends and family. Friends who came in here with skilled worker visa, who were already doctors and the rest of them. Sometimes I'll call and say, I beg, please, I'm trying to do this, and that. Give me £200. I need to sort out this issue. I'll give you back. So for every time I needed maybe a place to borrow money from, there were people who were willing to give me.
To
And
give you
they gave me because they knew that I was going to pay back at the day I said I'm going to pay back.
feedback. Yeah.
Sometimes it gets overwhelming, and I call my friend and say, so you go, how far? I'm coming to your place in Coventry. Let me just come and rest from all this madness. Like, okay, fine. And one thing about here is that if you're in the UK, traveling to other European countries is cheap, is easy. So there were times I made use of that opportunity, got visas, Schengen visa to Spain, took a trip, less than £100-200, and I came back too. Still here, got an American visa as well, and for me, I put traveling as a key part of my, distressing technique.
Technique. Yeah.
Yeah.
Okay.
Yeah. So that was the journey for me, really. You know.
So I mean, looking at the PLAB partner, so how were you able to, manage the whole preparation, writing the exams
Mm.
in the middle of the masters and all of that? I'm trying to imagine mentally the type of pressure you'd have been on. How did you, get around that?
So I would say that, remember I told you that I did fail some courses,
Yeah.
and I was looking back. That's a blessing in disguise, really, because what happens in the UK is that if you fail a course in first semester, you have, like, I think about 2 to 3 months after second semester to rewrite those courses. You get.
Okay.
So that gives you like a window, and a course that you failed, you already know what you have to do to pass this time
To
around.
pass, yes.
So that gives you like a period of nothingness, a period where you are doing nothing really. Imagine someone giving you 3 months to write a 3,500 word essay that you have written before. All you have to do is, okay, change this, put this and all of that. So I had a time of, actually doing nothing serious. And I still had to work 20 hours a week. So you see that I had like even 20 more hours of free time.
Okay.
So I put that into my PLAB. So this is what I did. Before I came to the UK, I was already studying for PLAB 1. Because I came into the UK August, September. Let me say September. My PLAB was November. Yeah. So I had September and October to prepare. However, before that time, I was already studying for it. So when I came into the UK, that last 2 months were for me to consolidate and finish up my last preparation for that lab one. And this was the time I failed the courses from first semester. So it was more
Mm.
like, let's sacrifice something. There's an option of receipt in 2 months. But with lab one, if you fail, you may not get date till another 1 year.
Yes.
So I put a lot of energy while using 1 year to be listening to the master small small. You get. So I passed the lab one, failed part of the masters. I'm like, okay, let's go and get the receipt. So I quickly did my receipt. It got me some time again. Then I started studying for lab two after my second semester. But
Okay.
I didn't pass my first attempt at lab two. And I would say for me, the reason was that I had been away from clinical practice or anything clinical for a long time.
Time.
So it was I failed that exam just before the medical support job came. So and I entered into medical support job. What I was now doing was purely clinical work, see patients, talk to patients, how to do this procedure, how to do blah blah blah, and the rest of them. So I made use of that opportunity to learn on the job, while I also, went through my materials, went through some videos. There's a video I used, one Dr. LCD video. I used that as well. Then my work partner in the job was also preparing for PLAB 2. So we
Okay.
kind of linked up and started doing intense study group. So in October, I took good thing is that the medical support also helps you secure PLAB dates straight from the
Oh,
GMC.
wow. Okay. Wow.
If you're working as a medical support worker and you have PLAB 2, they're going to pay you for that exam you are going to write. They see it as it's a day of work. They will pay you your money for that day of the exam. They are also going to call the GMC to secure a date for you. So you're going to open your portal and see that there's a date available to just you,
To go and write.
and for you to go and register. And the GMC will write to you, where you're a medical support worker, check your portal, this and that. You have your dates waiting for you there. Whatever date
Wow.
you choose,
Wow. Nice.
you get. So those were like some of the benefits that we got from. Apart from that, the job also gave me that hands-on experience. You get.
Mm-hmm.
So by the time then my dissertation has started, I spread my dissertation because I had a receipt. My dissertation did not start when my other people started, so I had like a prolonged time to do dissertation. So I fixed in my PLAB 2 in between, went in, wrote the exam, and passed. I wrote in October, passed in November. By December, I submitted my dissertation, and by January, I had the job from that. So summarily, I would say it's a lot, yes, but with planning and strategy, it's also very, very achievable. Really, I'll tell anybody, if you are coming to do a master's, have your IELTS already. Let's say you have your IELTS already. Before you come in, start preparing for your PLAB 1 already. Start preparing so that when you come in a few months, you write your PLAB 1. When you do your course, because coursework is usually very intense,
Yes.
and let your coursework finish. The moment you finish your coursework, there's a time for dissertation. By the time you and your supervisor are going back and forth with topic, no topic, proposal, no proposal, let's wait for ethical approval. Sometimes ethical approval can take 1 to 2 months.
Yeah. Okay.
So use that period and maybe do your academy or study for your PLAB 2. And by the time you now come back from the exam, you continue your project. By the time you are submitting your project, your PLAB 2 result is ready.
It's
You
out.
know,
Yeah.
and it's for me, I feel like being strategic, being intentional, and you know planning these things with that is very, very
Doable.
achievable. And it's I was able to get a job like real fast after the exam because I was already in the system.
Yes, as the medical support stuff, right?
Yeah, I was already in the system. I knew consultants. I had a good relationship with my line manager. Uh, I had a good relationship with the nurses, with my colleagues. I was even already teaching people doing PLAB 2 in the same hospital. I was already preparing them as well. Okay, do this, working together with my line manager. So I was just one day, I opened my email. My line manager has recommended me to a consultant that I think these guys are good enough. Me and another person, these guys are good enough for this vacancy.
Mm,
Consider them, interview them.
mm,
And I mean, that word alone, for someone to say, see this guy, let me send them.
mm.
It's almost like,
Strong recommendation.
it's wrong. It's
Yeah.
just it, you know. And I did the interview. Of course, before the interview, what I did was the girl who walked in the row, is a Nigerian girl.
Okay.
I went to meet her. I'm like, okay, during your interview, how did it go? What's the structure? What did they ask you? You know, and she just told me, okay, during my interview, they did this. So they asked me this, they asked me that. You know, the major cases we see are this and this in this thing. They asked me the management and all of that. You know, lo and behold, when the interview came, not like they asked me the same questions, but I already had an idea of how to, you know,
Approach the.
direct my answers. You know, one of them was just what they asked her. Then the second one was totally different. Of course, I'm
Okay.
sure they switch these things to be sure whether you are not a robot. You know, Hmm. You know, they can't be asking you maybe something about palliation now. They are going to talk about neutropenia and all the rest of them. So that's it. So they changed it, and I also answered this simply. Then they also start asking some common sense questions to even know, okay,
Questions.
how do you think you get? And
Mm-hmm.
you know, and I answered it, and after that, I went about my normal business, and they called me. You get. So that's how I was able to, navigate that part as well, really,
Hmm.
with the plab.
It's quite interesting, because some people usually are worried about them. How am I going to be doing the MSc and still preparing for PLAB 1, PLAB 2, and all of that? So it's good to know that it's really it's something that is doable, right? Then, yeah, I think the last question I'll have for you is, I mean, though you mentioned a couple of points,
Mm.
are there any tips that you want to, share for, some of us who might be considering coming to the UK for MSc and hoping to transition to, doctor
Yeah.
work and all of that?
Yes, I mean, I think the first tip would be to do dreadlocks. Just do that so that you know that we're coming to fight. Oh. It's a mad, it's a mad zone. Anyway, so sometimes people ask me, okay, why did you have dreadlocks and all of that? And I just laugh because for me, it was like I started keeping my hair at the point where, man, I was really, really struggling, with work, school. I was going crazy, and I'm like, you know what? Wait till they go barb hair for self. Let me focus on this, and this is just on the lighter note. But really,
Yeah.
I think um the tips I'll give is you first of all you have to have a plan. You have to have a plan. What is your plan really? Because do you um it's not enough to carry your bag. I'm leaving. Let me go to the UK or let me go to this country. We'll find a way around it. No. Yes, the plan might not be 100% sure, but you should know that, okay, once I come in here, I want to write this exam. I want to write this exam by so and so time. I'll do this, and I should be able to transition. That's one. Financially, you also have to have like a good amount of money to support you. for at least for the first few months. Like I did tell you, my father gave me 100% of my school fees.
School fees, yeah.
Yeah, and a little extra. And what did I do? I spread them with school fees and house rent for a while. You get. And within that while, I started looking for job. Somehow I was able to pay up and sort myself. So you also need to have like a good financial plan. Don't come here hoping that you will raise 50% of your school fees from work. Reason is that there's a job work restriction of 20 hours. If you do more than that, you put yourself at a risk of not getting a visa renewal. You understand? So
Mm-hmm.
now at that 20 hours a week, it means that your earnings are capped. You can't go above a particular limit. So most of the money you even have might just be going into rent and feeding. Like I did tell you, there was a time that every money I had, once I go out and work that and get that £800, £900, 650 goes into rent. If you take out 650 from 900, what is left?
Nothing is left. Yeah.
250. You are going to buy food or make food for the next 1 month. Before you know it, at the end of the month, you have £70 left. You have to go back. So is it that £70 that you're going to use to raise over 8,000 pounds? No, that's also not possible. So I would also tell people, see, the moment you get here, it's important that you start looking for a job that will give you sponsorship after your stay or after your study or towards the
Study.
end of it.
Yeah.
Yeah, because the rule before now, I don't know if that has changed, but it was like you should have done at least I think 7 to 9 months of studying before you can switch. But I heard that that has even changed, that you can switch from the next month if you have someone who is willing to
Sponsor you.
give you that sponsorship. So you start looking for those kind of jobs. Talk to people. Your greatest asset are human beings. Talk to people, get information, tell people to show you, teach you how to answer interview questions. Go if you are looking for a job in the hospital, look for those small small roles because it's easier for you to enter when you're at the door already.
Mm-hmm.
It's easier for you to enter when you're already at the door than for you to enter when you are far away. And that's how I entered. I went as a nursing assistant. I got close, close to the clinical area. Then went as medical support, got even closer, you know, to the to the patient area. And now I'm where I am. You get that's another this thing I would say. Collaborate with your people.
Think it's gone off a bit. He should be back soon.
Hello, can you hear
Okay.
me?
Yeah, I can hear you. Yes, please.
Yeah. Collaborate with your people. And lastly, for the academic part, which is very, very important, I would advise that if you come in, uh, look for people who have done the course before. Those of your people that have done the course, ask around people who have done the course before. Ask them to give you their previous works. Be able to once you read those works. Hello.
Yeah, I can hear you. Go ahead.
Once you read those works, it should be able to guide you. Then among your classmates, man, form study groups and pray too. That's what I have to say.
Very important
Yeah.
because you need to cover everything with prayers. Let me see if there are any questions from anywhere. Checking here. I can't see any questions. So I mean, so it's been an interesting conversation so far, and I mean, my takeaways from this conversation is the first thing is to have a plan, so you don't just start living Nigeria without a plan or living wherever you are without a plan. So it's good to have a plan. Then sort out your finances very well before you move, because that's very important. Then I think you also mentioned the importance of having a good support network, least you mentioned you had people who were, always available if you needed to borrow £100 or £200. So those friends and that network is good. Then, yeah, you mentioned asking questions. So information is key because apparently, I mean, it's only by asking that we get the information we want. So you need to always ask questions, then network with persons, collaborate with people. Then, look for people who have gone through that journey to ask how they did it and how they managed to get around the whole obstacles. Because I know it's not an easy thing, leaving Nigeria and coming to settle in a whole new environment all by yourself like that. It's it's a tough one, but it's good we have this conversation. At least I think it gives a lot of perspective into as to what happens out there, because I think a lot of persons don't have this information, because some people think it's all rosy and glamorous and all of that, but
Far from it.
it, it's very, very from your narration is very, very far from it. So thanks for coming on to this. So if you guys are watching from LinkedIn or Twitter, this stream will still be on my YouTube channel. So you guys can always come back to watch it, and probably maybe there are a couple of things you missed and all of that. So I know there was a break somewhere, but I'll try to merge two of them together into one complete video so that you can
Okay.
watch, yes, in one sitting, right? I think that's it for tonight. So until next episode, guys, we'll see you soon. Bye for now.
Thank you very much for having me.
All right.
I really appreciate this session. All right now. So can